Routes of drug administration. Route. The route of drug administration is simply defined as the path by which a drug is taken into the body for diagnosis, prevention, cure or treatment of various diseases and disorders. Route/channels of drug administration. Enteral routes of drug administration. Enteral route is the most common route of drug administration. Enteral administration delivers the compound into the body through the gastrointestinal, GI, tract. Both ends of the GI tract can be utilized, the mouth and the anus. Oral route. Oral refers to two methods of administration. Applying topically to the mouth. Swallowing for absorption along the gastrointestinal, GI, tract into systemic circulation. PO, from the Latin per os, is the abbreviation used to indicate oral route of medication administration. Advantages. Convenient, can be self-administered, pain-free, easy to take. Absorption, takes place along the whole length of the GI tract. Cheap, compared to most other parenteral routes. Disadvantages. Sometimes inefficient, only part of the drug may be absorbed. First pass effect, drugs absorbed orally are initially transported to the liver via the portal vein. Irritation to gastric mucosa, nausea and vomiting. Destruction of drugs by gastric acid and digestive juices. Effect too slow for emergencies. Unpleasant taste of some drugs. Unable to use in unconscious patient. First pass effect. The first pass effect is the term used for the hepatic metabolism of a pharmacological agent when it is absorbed from the gut and delivered to the liver via the portal circulation. The greater the first pass effect, the less the agent will reach the systemic circulation when the agent is administered orally. Oral dosage forms. Common dose forms for oral administration. Tablets. Capsules. Liquids. Solutions. Suspensions. Syrups. Elixirs. Sublingual route. Sublingual administration is where the dosage form is placed under the tongue. Drug rapidly absorbed by sublingual mucosa. Two examples of drugs available for sublingual administration are nitroglycerin for treating ischemic heart disease and hyoscyamine for treating bowel cramps. Advantages. Economical. Quick termination. First pass avoided. Drug absorption is quick. Disadvantages. Unpalatable and bitter drugs. Irritation of oral mucosa. Large quantities cannot be given. Few drugs are absorbed. Buccal route. Buccal administration is where the dosage form is placed between gums and inner lining of the cheek, buccal pouch, absorbed by buccal mucosa. Fentanyl, a potent opioid analgesic, is available in an oral transmucosal formulation, ATIC, with a lozenge on a stick, lollipop, for rapid absorption from the buccal mucosa in the treatment of breakthrough cancer pain. Advantages. Avoid first pass effect. Rapid absorption. Drug stability. Disadvantages. Inconvenience. Advantages lost if swallowed. Small dose limit. Rectal route. Rectal administration via suppositories or enema to produce a systemic effect is useful in situations in which the patient is unable to take medication orally, example is unconscious, vomiting, convulsing. Drugs are absorbed through the rectal mucosa. Advantages. Drug forms are delivered by suppository, used in children, or enema. Little or no first pass effect. Used in, e.g. aspirin, theophylline. Vomiting/unconsciousness. Higher concentrations rapidly achieved chlorpromazine. Disadvantages. Inconvenient. Absorption is slow and erratic. Irritation or inflammation of rectal mucosa can occur. Parenteral routes of drug administration. The parenteral route, also referred to as injection route, is the fastest and the second commonest route of drug administration. The term parenteral is made up of two words, par meaning beyond and enteral meaning intestine. Hence, we can say that parenteral administration literally means introduction of substances into the body by routes other than the gastrointestinal tract. Parenteral administration of drugs can be performed by injection, small volumes, infusion, large volumes, or implant, and while its typical goal is to achieve rapid systemic effects, it can also be used locally on a given region, tissue, or organ by injecting the drug substance directly on the site of action, in order to achieve high drug concentrations in the site of action and/or minimize systemic adverse effects. The most important and most frequently used parenteral routes are intravenous route, 4, intramuscular route, IM, and subcutaneous route, SC. Various parenteral route types. A parenteral injection is of different types, each type is required for different forms of medication, and every type has a separate method. A few of the parenteral route examples are intramuscular, subcutaneous, intravenous, and intradermal injections. All the types are explained below. Intramuscular injection. Intramuscular injection or IM is the injection of a medicine or drug into the muscles. It is one of the numerous methods used for the parenteral administration of medication into the patient's body. Intramuscular injection is often preferred over other methods because muscles have numerous blood vessels than the subcutaneous tissue which fastens up the absorption of the drug than subcutaneous or intradermal injections. Medications or drugs that are administered through intramuscular injections are not subject to the first-pass metabolism effect which can affect other oral medications. Subcutaneous injection. A subcutaneous injection is directly administered into the subcutis. It is the layer directly below the dermis and epidermis. It is collectively referred to as the cutis. Subcutaneous injections are effective in administering medications like insulin and morphine among others. Subcutaneous tissues have very few blood vessels, thus the drugs injected here are meant to act slowly at sustained rates of absorption. Intradermal injections. Intradermal injections, often abbreviated as ID, are shallow or superficial injections of any medication into the dermis, between the epidermis and the hypodermis. ID injections are complex and are not the preferred route of administration for injection. They are only used for certain therapies like tuberculosis tests and allergy tests. Intravenous injection. Intravenous injection, often abbreviated as 4 injection, is a traditional medical technique that helps deliver fluids, medications, and nutrition to a person directly into their vein. Intravenous injection is also used to administer medical therapies and other medications like blood products or electrolytes to regulate electrolyte imbalances in the patient's body. Intravenous therapy was recorded as early as the 14th century but failed to become widespread until the 19th century till the techniques were developed for safe and effective medical use. Other less frequent routes, specialized parenteral routes, are summarized below. Intraspinal route. This involves the administration of a drug within the vertebral column. The two most frequent routes for intraspinal drug delivery are epidural route and intrathecal route. These routes are used primarily for anesthesia, e.g. lidocaine, bupivacaine, and pain management, e.g. opioid analgesic. Epidural route. This is a method of drug administration in which a medicine is injected on or over the dura mater. The drug must be filtered through fat and veins to reach the nervous roots, thus delaying the beginning of the effect. It supports permanent catheter chelation. Intrathecal route. This route involves direct administration of drugs into the subarachnoid space, i.e. the cerebrospinal fluid, CSF, through a lumbar puncture needle. This route offers the advantage of high availability of the drug in the CSF as the blood-brain barrier and blood-CSF barrier is bypassed. Hence, the drug acts directly on the central nervous system, CNS. Intrathecal administration does not support permanent catheter. Intra-arterial route. Intra-arterial route involves direct administration to an artery, generally for local effects over irrigated organs or tissues. For example, antineoplastic injected in the surroundings of the tumor, with a decrease of systemic adverse effects. It is also useful for the administration of vasodilators in arterial embolisms or contrast media for arteriography. Intracerebroventricular route. This involves direct administration to the cerebral ventricles. This route bypasses the blood-brain barrier and other mechanisms that limit drug distribution into the brain, allowing high drug concentrations to enter the central compartment. Intracardiac route. This route of drug administration is used only as an emergency route during a cardiac arrest, adrenaline injection into cardiac chambers, due to the serious injuries that may be caused by the needle. It involves direct administration of drugs into the heart. Intra-articular route. This involves direct administration on a joint, generally for local effects. For example, anti-inflammatory corticosteroids for arthritis. Intralymphatic route. Intralymphatic route involves administration of drugs into a lymph node or a vessel. It is used, for example, for the administration of stem cells during the treatment of autoimmune diseases, antitumoral therapy, and/or for diagnosis purposes, contrast reagents injection. Intraosseous route. This involves direct administration of drugs into the marrow of a bone. It can safely be used to administer any intravenous drug or fluid required during pediatric resuscitation, since the vascular bed of these bones quickly transports the drug to the rest of the body. The onset of action and drug levels are comparable to those achieved when drugs are given intravenously. Intraperitoneal route. The injection is given in the peritoneal space, leading to a high absorption rate credited to the available large surface area. This route may cause infections in the peritoneal cavity and is painful and risky. Advantages of parenteral route of drug administration. Advantages of parenteral administration are as follows. Parenteral route of drug administration is the route of choice for drugs that have poor absorption in the GIT and drugs like insulin which are unstable in the gastrointestinal tract, GIT, and/or that are unstable in the GIT, e.g. insulin, heparin. Parenteral routes could be used in unconscious, uncooperative, and vomiting patient or under circumstances that require rapid onset of action. Bioavailability is faster and more predictable. Interference by liver metabolism is avoided. There are no chances of interference by food or digestive enzymes. It is essential sometimes in the absorption of the active form of the drug. Disadvantages of parenteral route of drug administration. Major drawbacks of parenteral administration are as follows. Drug administration by these routes is irreversible and poses more risks than the other routes. It is an invasive route of drug administration and thus, it can cause fear, pain, tissue damage, and/or infections. Injections have limitations for the delivery of protein products, particularly those that require sustained levels. It is generally riskier. The preparation to be injected has to be sterile. Drug administered by parenteral routes with the exception of intra-arterial route might still be eliminated by first-pass metabolism in liver prior to distribution to the rest of the body. Help is always needed to administer a parenteral dosage form. Comparison of the intravenous, intramuscular and subcutaneous route. Feature. Intravenous route. IV. Intramuscular route. IM. Subcutaneous route. SC. Site of administration. In the vein lumen. Large muscles like deltoid, dorsogluteal etc. Loose subcutaneous. Tissue under the skin. Depot preparations. Can't be made. Can be made. Can be made. Absorption rate of drugs. Highest. In between IV and S.C. Slowest. Assistance. Required. Required. Not required. Irritant drugs. Can be given. Mild irritation causing drugs can be given. Can't be given. Risk frequency. High. Lower than intravenous. Route. Low. Time until effect. 30 to 60 seconds. 10 to 20 minutes. 15 to 30 minutes. Recommended volume. Small to large volumes. 2-5 ml. Less than or equal to 2 ml. Topical routes of drug administration. Topical route of drug administration refers to the application of medication to the surface of the skin or mucous membrane of the eye, ear, nose, mouth, vagina, etc. with the intent of containing the pharmacological effect of the drug only to the surface or within the layers of skin or mucous membrane. Drugs for topical application are usually available as creams, ointments, gels, lotions, sprays, powders, aerosols, liniments, and drops. Skin, when pastes, ointments, creams, lotions, sprays, and dressing material are applied on the skin, this is a part of topical route. Mucous membrane, the dosage form depends on the site of application. Mucous membrane. Topical route of administration provides a high local concentration of the drug without affecting the general circulation. However, absorption into the systemic circulation is very common and can lead to adverse effects. Sometimes, this systemic absorption is made use of, for its therapeutic value. Topical preparation and its site of application. 1. Mouth and pharynx. Mouthwashes, paints, gargles, lozenge. 2. Eyes, ears, and nose. Drops, ointments, nasal spray. 3. Gastrointestinal tract. Non-absorbable drugs. 4. Respiratory tract. Inhalational dosage, aerosols. 5. Urethra. Jellies. 6. Vagina. Pessaries, creams, powders, vaginal tablets. 7. Anal canal. Ointment, suppositories. Advantages of topical route of drug administration. Useful for local delivery of agents, particularly those which have toxic effects if administered systemically. Used for most dermatologic and ophthalmologic preparations. Avoidance of first-pass metabolism. Convenient to use and easy to apply. The gastrointestinal incompatibility will be avoided. Avoidance of the risks and inconveniences of administration and the varied conditions of absorption, like pH changes, presence of enzymes, gastric emptying time, etc. in enteral or parenteral routes. Easy termination of medications when needed. Drug delivered selectively to a specific site. Provides drug utilization with short biological half-life and narrow therapeutic window. Better patient compliance. Suitable for self-medication. Avoids fluctuation in drug levels and risks. Provides effectiveness in low doses and by continuous drug input. A large area of application compared to other routes. Improved physiological and pharmacological response. Disadvantages of topical route of drug administration. Most drugs have a high molecular weight and are poorly lipid soluble, so are not absorbed via skin or mucous membranes. Possibility of local skin irritation at the site of application. Contact dermatitis due to some drug and/or excipients may occur. Can be used only for those drugs which require low plasma concentration for action. Enzymes in the epidermis may denature the drugs. Inhalation route of drug administration. Volatile liquids and gases are given by inhalation for systemic action, e.g. general anesthetics. Absorption takes place from the vast surface of alveoli. Action is very rapid. When administration is discontinued, the drug diffuses back and is rapidly eliminated in expired air. Thus, controlled administration is possible with moment-to-moment adjustment. Irritant vapors, ether, cause inflammation of respiratory tract and increase secretion. It involves drug administration directly into the respiratory tract. Advantages. Drugs as gases or aerosols can be rapidly taken up or eliminated. Disadvantages. Special apparatus is needed. Drug must be non-irritant for conscious PTS. Time until effect. Intravenous 30 to 60 seconds. Intraosseous 30 to 60 seconds. Endotracheal 2 to 3 minutes. Inhalation 2 to 3 minutes. Sublingual 3 to 5 minutes. Intramuscular 10 to 20 minutes. Subcutaneous 15 to 30 minutes. Rectal 5 to 30 minutes. Ingestion 30 to 90 minutes. Transdermal, topical, variable, minutes to hours. Selection of route. Choice of route of drug administration depends on rate and extent of drug absorption. Onset of action of drug by various routes. Patient condition and compliance. Body's response. Physical and chemical properties of the drug. The speed which the drug is absorbed and/or released. The need to bypass hepatic metabolism. To achieve high concentration at particular sites. Accuracy of dosage. Site of action.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.